This is the pelvic girdle. If you go to page 3 for a second, number 1, the pelvic girdle consists of a pair of hip bones like I have right here. I just wanted to show you, they're also called coxal bones, if you want to call this a coxal bone, or you want to call it an innominate bone. I think the hip bone is the easiest thing to say. So this would be a hip bone, but you would not be wrong to say coxal. I do say that sometimes. Innominate, I don't say very often. When I was in school, that's what we actually called it. But I think the hip bone is just easier to say. Now, I want to show you this. Here's a picture in your book. The hip bone, if you can take a look up here for 1 second, guys, is actually a combination of 3 bones that fuse together. So I want to show you in the kind of the middle of the hip bone, there's a deep cup right here. This deep cup receives, anybody know what bone this is here? The femur, right? Thank you, the femur bone. So to make our hip joint when we walk. This deep cup is called the acetabulum. Okay? The deep cup is called the acetabulum. Right up here. Guys, let me get your attention. This is kind of just a little bit tough. I'll let you work with it in a minute. Just kind of focus up here for 1 second. So the acetabulum is the uniting place of the 3 bones that make up the hip bone. So if you kind of see the upper part of the acetabulum from here, that bone is called the ilium. So kind of here's the acetabulum from my finger up. This whole thing is going to be the ilium, and we'll look at its parts. The front part, like here, like to the front, is the pubic bone. So the front part of the acetabulum in here, this is the pubic bone. And then now the back part, you're kind of sitting on this part here. This is called the ischium. So the hip bone, or the os coxae, is made up of the ilium above, the pubic bone anteriorly, and the ischium posteriorly. Ilium, pubic bone, ischium. Okay? Before we look at that, I put on everybody's table a pelvis. So I want to show you real quick a couple of landmarks. On page 3, go to number pelvis. Go to number 3 where it says pelvis, and we're going to go down to the anatomy. The first landmark I want you to find is right here. This rim right here is called the pelvic brim. Pelvic brim. Now, the pelvis below the pelvic brim, this area right here, if I put my hand in here, this is called the true pelvis. This would contain like the ovaries, the uterus, the prostate gland in the male, the bladder in both sexes, the lower part of the colon, the rectum, things like that. All these structures are in the true pelvis. But notice, the true pelvis is below this rim right here. Above the rim in here, where my hand is right now, this area, this is called the false pelvis. So this has mostly intestines inside here, like that's kind of the main thing we see here is the intestines. So the false pelvis is above the rim. The true pelvis is below the pelvic brim. Let me see that for a second. So I want to show you something real quick. Take a look. This right here is called the pelvic outlet. This has significance for a female as far as birth. So let me ask you this. Look at the 2 pelvic outlets. Which one would you rather deliver a baby out of?
The one on your right hand.
This one or this one?
The right hand.
Number 1, right? This one over here. So that means this is a female pelvis opposed to a male pelvis. Just hold that for me a second. So what we look at, when a female goes for that first ultrasound to see, if the baby's healthy, does it have kidneys and a heartbeat and all that stuff. What they also measure on the ultrasound, guys, is this. We don't know the parts yet, but these 2 points sticking in right here, how far apart they are. They're called the ischiospines. then the things that you're sitting on right now, these are called the ischiotuberosities. They measure how far apart they are. And then look at the sacrum, it's nice and flat. The coccyx is off here, but the coccyx would also be nice and flat. They measure this difference also. So when they make these measurements, they can actually determine already the very first ultrasound probably, this is going to be a vaginal birth first of all, and then how easy is that vaginal birth going to be. If the female did have a small pelvis, now this is a male pelvis, but take a look at the ischiospines, how close they are, the ischiotuberosities. Look at the male sacrum. See how bent it is? It's curved, and the coccyx, right? This is just in the way of the baby's head. So if a female had a small pelvis like this, chances are they going to deliver it vaginally? More than likely not. They'll do a section. Yeah, they'll do a section. So these are some of the considerations that are done on an ultrasound with an OB visit, right? So they're looking at the pelvic outlet. That's this right here. Okay, so you can see some differences between the male pelvis and the female pelvis. This is the best way to look at it. You know, if you're taking pictures, take a picture of this both side by side like this. This way you have a good idea. Okay. Questions or comments? This was yours. We'll give that back to you. We're good? Okay. This was yours. So guys, in your box, if you can take out, if you haven't, you can either use the whole pelvis and then one of these here. Okay. Okay, guys, ready? So, again, this was the hip bone. It's made up of the ilium up top, the pubic bone in the front, and the ischium in the back. Let's do the ilium first. But again, I just want to ask you, because I do ask this on the test a lot of times. These three bones all fuse at this cup right here. What's the name of that cup? Acetabulum. Acetabulum. And again, just to compare it to the shoulder joint, look how deep that cup is. The head of the femur sits in there. So this joint is hard to dislocate, but do you have the same range of motion of the hip joint as you have as your shoulder? Not nearly as much. I mean, you can flex pretty far, you can extend somewhat, you can come out somewhat and in, but it's not like the shoulder joint because it has a deeper cut, but it's a more stable joint. It's again, if you dislocate this, you were hit by something hard. Right? This just doesn't happen. Right? To dislocate your hip, it just doesn't happen. So it has to be really traumatic. So let's take a look at the ilium first. What do I have first? We're on the bottom of page 3. So do me a favor, go like this on yourself. Take your fingers like this. Go to your waist, where your waist indents, push in and down. Feel that bone that you're on? Yeah. You are on this whole ridge of bone right here. That is called the iliac crest. So this big ridge on the top of the ilium, iliac crest. A lot of our abdominal muscles, the oblique muscles, they are attached to this thing right over here, this iliac crest. Now, watch me for a second. If you were to go on your iliac crest and walk your fingers forward like this, you're going to come to a bump right here. This is called the anterior superior iliac spine. I will let you abbreviate it ASIS. This is the one, if somebody's laying on their back, like this guy's laying on his back now, you see those two bumps sticking up, one here and one on this side, right? On somebody's, when they're laying on their back, they kind of stick up. Those are the ASISs, okay? Now go down a little bit, you're going to see another bump. You'll see it's not quite as big, but it's below. This is the AIIS, anterior inferior iliac spine. Okay, so you have a superior iliac spine and an anterior I'm sorry, inferior iliac spine. Superior iliac spine, inferior iliac spine. Both of these are on the front, anterior. Okay? Go back to your iliac crest for a second. If we were to walk our fingers backwards this way now, go posterior, you'll feel or see this big bump back here. This is the posterior superior iliac spine. So what can we abbreviate that? PSIS. PSIS. Do you ever see somebody, you look at them from behind and they have no clothes on, you'll see the sacrum here, then you see like two dimples, like two rounded areas on either side? That's where the PSISs are. And if you put your hand there and touch them, they feel like a little marble. That's what you're feeling. So you know what I'm talking about, right? Those two dimples, PSISs. Okay? Then you go down a little bit. There's a little bit of a lesser bump. This is the posterior inferior iliac spine. PIIS. Posterior inferior iliac spine. Okay? So it's not that hard. You have an iliac crest up top, then you go to the front. Two iliac spines. One is superior, one is inferior. You go to the back. Two iliac spines. One is superior, one is inferior. Okay? Anybody, questions or comments on those? Now, from the PIIS, the posterior inferior iliac spine, check this out. There is a big notch right here. It's called the greater sciatic notch. What nerve do you think runs through there? The sciatic nerve. Our sciatic nerve, if you ever get a chance to do human dissection, is about the width of your thumb. So it fits right inside that notch. It's a big nerve. So it fits right, it runs right through that notch as it goes from inside your pelvis to the outside of your pelvis. And then it goes down your leg, so it kind of hangs around like that. So that's the greater sciatic notch. Okay? Now, last two things, guys. On the front side of the ilium, mine's not that great, so I'm going to show you on here. This is a depression called, we talked about this before, the iliac fossa. Big, shallow depression. So this whole thing, iliac fossa. Okay? And then finally, where the ilium articulates, remember last week with the sacrum? Let me see if I have a sacrum in here. Ooh, I do. So last week when we looked at the sacrum, remember this thing that looked like an ear? Like the ear? This was called the auricular surface. This articulates with the auricular surface of the ilium. So this is where the sacrum attaches to the ilium. So both of these are called auricular surface. Remember, it looks like your ear, this whole outside here, this is called the auricle. Okay? And this joint right here, I won't ask you this on a test, but if you're interested, for those of you going into physical therapy or orthopedics, this joint right here is called the sacroiliac joint. Sometimes people will hurt their sacroiliac. They've got pain like right in the ass, like right over there, sharp, stabbing pain. They limp around like you, but they just have ass pain, they don't have knee pain. And they're like, they're just walking around like that. It's really like a sharp pain. So that's the sacroiliac joint. Sacroiliac, okay? Auricular surfaces. Anybody, questions or comments? Right? So that is the ilium. Again, it's not that difficult. Again, one more time. What's the point where the hip goes? What's this cut called? Acetabulum. Good. For some reason, people always forget that one, so I just want to keep reminding you. Okay, let's do the ischium next. We're on page 4.